Deep flow is not a technique, but a way of life. We believe that to work with others, we have to start with ourselves first, with developing the ability to create and live the life you truly believe in or seek for yourself.
The foundation program introduces principles of alignment in the context of manual therapy. So what this means is that we look at the client. We always start by looking at their posture, and what we're looking for is imbalances that are often obvious or general, such as the way the feet are positioned on the ground, the way their weight is carried on their feet, locked knees, pelvic tilts, rounded shoulders, and then the way the head bobs on the whole structure. And based on the information we gather from the observation, then we use the manual therapy to glide, to guide, to bring the tissues into the place where they're maybe meant to be, or the optimal alignment. And based on what we find, we're also looking at the breath and how the breath carries the whole system, the whole structure from within. Then ultimately, we're picking cues and clues along the way to give them back to the client and educate them about how they carry themselves and maybe what is the root of their imbalances or chronic pain. Basically, the foundation program is the relationship between bones, soft tissue, and breath. We have this concept sometimes that the bones are really supporting us, when really the bones are floating in the soft tissue, which we call the fascial matrix, or the myofascia, which is fascia that relates to muscle. And so in the foundation program, if you're addressing the fascia and opening the matrix, opening the envelope, then you have to go and visit the bones and guide them, push them, invite them into the new position or the new space, and go to the breath, and then look at the breath and see if you can guide it, invite it, and coach it into this new area as well, into the space that was created. So we're visiting the bony structure, the envelope, the fascia that it's held within, and then having a look at how the breath is traveling, entering this area. So this course introduces the concept that the treatment or our work is not what fixes or what takes away the client's pain. Through the body work, or through the hands-on approach, we use what the body reveals to educate the client on what's happening or what's not happening. And so ultimately what we're looking for is a study of how their body functions and how they carry themselves, or how they do what they do, and then apply simple mindfulness principles so that they go back into their lives with just a little bit more information about how their body works. When I teach this course, I realize that most practitioners, most people work way too hard. I want to teach you to dance with the tissue, to interact with the tensions, and to work with the body, not push your way through and actually hurt yourself for the sake of helping others. And so the interesting thing about manual therapy and myofascial release is where the hands are is rarely where we are. Where the hands are is the contact point, but the eyes are always taking a global view, looking at the whole body, constantly being a step or two ahead of where the hands are actually touching. People often refer to this course as a journey for the soul instead of a course, because Deep Flow's main focus is to take care of their practitioner. I mean, the more we take care of the people in the classroom and develop their biomechanics so that when we look in the classroom, it looks like a Tai Chi garden. Maybe not, but at least it looks easeful. It looks pretty. It looks like it feels good to them to deliver depth. So together, we really have to redefine depth. Where it comes from in your body, where it comes from is really the main focus is where your feet connect with the ground. So ultimately, your lower body, your groundedness delivers the pressure through your hands without any force, without any strain on the practitioner's body. And so who is this course for? It's for massage therapists, yoga teachers, yoga therapists, physios, anyone who works with the body and who is interested or curious about entering the amazing world of the fascial matrix.